Hey everyone, and welcome to Shine Chats. Today we're going to discuss integrating electronic dental and medical records. This groundbreaking initiative, led by FDI, World Dental Federation, aims to create a framework for unifying digital health information systems. And today we have the pleasure of talking with Dr. Valley, who's helping head this whole thing up. And I'm so pumped because I've gotten to work with her in the past. So let's get right into it. So, can you provide a brief overview of the indicators and explain a little bit about how they should be applied in a clinical setting? Because I know that's a big deal.
Now, first of all, periodontal health, and we know how much has an impact on general health. And thanks to supporting from WHO, who has finally now made a declaration which says that there is no health without oral health. So the periodontal disease is one of the key issues which need to be there because to understand the patient behavior and also the impact to the general health. The second is caries or endodontic needs, because we need to have a surveillance of the disease development and also about the general oral health situation, which kind of is it multi-caries or which kind of situation it is, and it has also the same time impact to the whole body or even the working conditions of the patient or the children in school. Oral cancer, the screening and examination, the all mucosal lesions, precancerosis is very important to be in the integrated health record that the medical doctors can also see these kind of issues in what are in a patient's mouth. The general status of the mouth gives a lot of information, not only for us as a dentist, not only because of that, but also for the different health policy situations. Then medical devices like implants. We know how many different systems are there. So this is a must to be integrated, to know which kind of system is there if they goes to another doctor, because we know that the whole world is globalized. So it's very valuable information of the medical devices. Then prescription data. I myself, as we use the integrated system, I see it's a very important issue. Prescriptions, which kind of prescriptions are, what we are also, I think how much antibiotics we are using or what kind of pills the patient is taking. Allergies. Also, we can cause allergies with our materials. These need to be there and also to find out. So it is both, it is linked in both parts. And radiographs, very, very valuable to avoid this, duplication, making many x-rays when you can have information by looking there, the development, which is very important also to see. And if we're nowadays doing a lot of 3D images, this need to be there, that it's not every doctor is making another x-ray, or sometimes yes we need to do it because of emergency situation, but generally speaking, if this data is there, it's a must to be there.
I really think that AI is going to be a huge part of this coming up and really helping people apply it. But what strategies have you found effective in making EHR adoption a smooth and valuable transition for a healthcare provider? Because I think it has to be for everybody to do this.
It is to have a collaboration with the IT people, with the end users, so it means dentists, medical professionals, the same time, first to start on what we need, like we do now, what is important to be integrated there, and what kind of information we need, and that the developers can develop the system which is very user friendly. This is very important. Another important issue to take is how, anyway, the integration in the member states is, or in a country, that it is the technical part. To have what we need to have are these kind of standards, technological standards and terminology standards.
Yeah.
It's very important. But what I think what the dentists or the medical professional and most of all the patients will win, that we have all data there. AI can help to sort out what is the most valuable at the moment, and you can use it, and you can make the decision, or really informed decision. And what is important to implement it is that the government is really, that the state is investing in these systems, that it can be developed, and at the end it is the positive results for the state too, to have it. But most of all, never forget our patients who will receive the best treatment, because it's based on the information.
And the work being done stands, to streamline healthcare record management and significantly improve patient care across disciplines. So we really look forward to seeing how much this initiative evolves and transforms healthcare systems worldwide. So thank you so much for sharing these valuable insights. I'm sure everybody's going to take them away and try to go apply them. And I really recommend that everybody check out this consensus document and get excited about it, because it's ready for all of us to do. And thanks for joining us on Shine Chats.